I've never told anyone this, not my coworkers, not my family, not even my therapist. But maybe I need to say it, even if it's anonymous, because I've carried this weight for years. And it started on a night shift I'll never forget. I'd been working in the ICU for 3 years. It was a rough stretch. COVID had just begun easing, but the burnout stayed. That night, the unit was full. Alarms everywhere. Staff short by 2 nurses. And I was covering 2 ventilated patients, both post-op, both unstable. One of them, male patient, Mr. Ali, was 52 years old. Cardiac arrest a week earlier. Now recovering, but fragile. He was on multiple drips, including injection noradrenaline. His BP was dropping slowly. Nothing too alarming till it was. I remember standing at the nurse's station, updating a chart. The ICU lights always felt colder at night, like the silence itself was waiting to be broken, and it was. Beep, 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 then beep, more, faster. Mr. Ali's monitor flashed red. Blood pressure 52/29. Heart rate erratic. I rushed in. His central line had blocked. No flow. The injection noradrenal wasn't going in. I fleshed it. Nothing. Repositioned the line. Still, no flow. My hands were trembling. I shouted for help. The resident arrived. The consultant was stuck in the cath lab. Peripheral access, boluses, CPR when his heart finally gave in. We got him back, then lost him again and again, until the final flatline. I don't remember walking out of the room. I just remember looking down at my glove-stained, shaking hand, realizing something. I'd missed it. The line had shown signs of occlusion hours earlier. Sluggish flow, back pressure on flush. But I was juggling too many patients. I didn't document it. I didn't escalate it. And now, he was gone. Everyone said it wasn't my fault. We were understaffed. It was a high-risk case. It happens. But I knew the truth. I should have seen it coming. And I've never forgiven myself for that. His daughter came 2 days later. She brought in a thank you note she'd written for the ICU staff before his sudden death. Thank you for giving us 2 more weeks with him. Thank you for trying. I wanted to scream, to confess, to say I could have done more, but I didn't. Since then, I've been different. Hypervigilant, overchecking every line, every flush, triple charting everything. Some call me obsessive. They don't know why, but I do. Because that one night still follows me. In every silence between beeps, in every line that doesn't flush right, in every dream where I hear the alarms too late. Learning lessons for healthcare workers. Mistakes in healthcare haven't been when we do everything right. Systems fail. Staffing gaps cause harm. But that doesn't mean we carry the blame alone. turn guilt into vigilance, but also into compassion for yourself and for your team. Learning lessons from medical and nursing students. Learn from every close call. Speak up early. Escalate. Trust your clinical gut. And remember, you're human. You're allowed to make mistakes. What matters is what you do next. Learning lessons for the public. Nurses and doctors carry more than charts and medications. They carry grief, doubt, sleepless nights. When a life is lost, we don't just move on. We carry those names in silence. Closing reflection. I don't share this story for pity. I share it because maybe someone else out there needs to know they're not alone. Yes, I still blame myself. But I also became better because of it. More careful, more present, more human. That night changed me, and maybe it was supposed to. We are silent scrubs. And some stories we carry not in our charts, but in our souls.